Hello everyone, I am Dr. Chaitanya Reddy, consultant psychiatrist from Asha Hospital, Hyderabad. Today I would be speaking mainly about psychiatric issues in relation to women. So being a woman, we can understand that she has to go through many hurdles in her life. So similarly, a woman also is susceptible to mental health issues more than a man. A woman can have any type of psychiatric illness just like man, but there are certain mental health conditions which are more common in females when compared to males. What happens if a woman is affected by mental health issues? So when a woman gets affected, it's not just her, but it's her entire family that's going to be affected indirectly. So nowadays the woman is playing a dual role as a housewife as well as a earning member in the family. So the amount of stress that she is facing nowadays is increasing day by day. Hence the more and more number of mental health issues that she is susceptible to. And also, how could the family help her in coming out of these mental health issues? A good understanding family environment, a good supporting partner is what that is essential. And also when coming to the children, understanding children and who can help her in her day-to-day activities, these are certain things which can help a woman in preventing mental health problems in her. Women are likely to identify mental health issues and they are likely to express their feelings and their mental health issues earlier when compared to males. But usually these are not taken seriously by the family members. If at all these are taken seriously and they are treated early, the earlier the treatment, better would be the response and better will be the health of the entire family. So women are more likely to develop depression, anxiety when compared to males, mainly during the reproductive period from the teenage till the menopause. Women are 2 to 3 times more likely to have depression and anxiety when compared to males. And the symptoms of depression and anxiety are slightly different in females when compared to males. Women are more likely to have feelings of hopelessness, worthlessness. They are likely to have more of crying spells when compared to males when they are depressed. They become gloomy. They sit at one place, less likely to work, and more likely to commit suicide when compared to males. So when you find somebody in your family, a woman mainly, who is identified with these symptoms, a timely help would be of great help. Why do women suffer from more depression during the reproductive period? It is the hormonal changes that she is going through which is responsible for this. Beginning with the menarche, going on to her menstrual cycles, then the menopause, in between there is the pregnancy and the delivery. So these are all the phases wherein their hormones are likely to keep changing, which increase her risk for depression. And then coming to anxiety, usually women are likely to think a lot for most of the issues, so which puts them at risk for anxiety. Apart from thinking, they are likely to be brooding a lot. Women don't leave things early on. They try to think a lot, and that's the reason why they are likely to become more anxious. And they feel very restless. They are worried about things. They're not able to focus on their work. They have palpitations. They have excessive sweating, dryness in the mouth, increase in frequency of micturition and defecation. You find them pacing here and there in the house. They are not able to cook properly as compared to the previously. You find them to be very much tensed. Then you should doubt if they have any kind of anxiety. It's not always that they have some cause before they have anxiety. Sometimes anxiety may start without any reason, and a genetic cause can be a reason for depression and anxiety in women. Apart from reproductive age group, even during after the menopause also women are likely to be depressed, but the rate of depression after menopause in men and women are likely to be the same. Then the third thing that I want to discuss is about the postpartum depression. So most of the new mothers are likely to feel low after their delivery. It's because of the sudden fall in the hormonal levels in her body. She is prone to become very low and worried, crying. So when this is milder and thus just for sadness, then we consider it as postpartum blues. When the same sadness persists for beyond 2 weeks and the sadness is severe, continuous, and it is also associated with suicidal thoughts, they are also likely to feel that they are a bad mother, and they are also worried about the safety of the baby. Gradually, they don't take care of the baby very well. They are likely to develop suicidal thoughts. The sleep becomes disturbed, the appetite gets reduced, and their self-esteem comes down, their confidence comes down. These are all the symptoms of postpartum depression. So the hormonal changes are definitely the reason for postpartum depression, but there is treatment for postpartum depression. So antidepressants, which are safer even during lactation, are the treatment of choice for these women. So don't worry if you are lactating and you suffer from depression. There are medicines which are safer for you. You can tell your doctor when you are lactating as well as suffering from depression. So there is definitely a good treatment for women suffering from depression during their lactation period. But what if you don't get treated? It's not just you that who is affected, but it's also your baby. If you are not able to take care of the baby, it's the baby's health that is also affected if the timely treatment is not given to the mother. Coming to vitamin B12 deficiency, these days we are hearing a lot about vitamin B12 deficiency. Many of them in India are suffering from vitamin B12 deficiency. One of the reasons is B12 is abundantly found in non-vegetarian diet. The meat is the most common source, but in vegetarian diet it's only the dairy products which are the sources of vitamin B12. So those people who are maintaining on vegan diet and avoid including dairy products also are likely to develop vitamin B12. So vitamin B12 is essential for the myelination of neurons as well as synthesis of certain neurotransmitters like serotonin and dopamine. So a person with low levels of vitamin B12 can be at a greater risk of depression compared to a person with normal vitamin B12 levels. So a person with vitamin B12 levels as well as depression have additional symptoms along with depressive symptoms like fatigue, tingling and numbness in the hands and feet, pallor, palpitations, shortness of breath, decreased concentration, sleep disturbance. So these are all the symptoms along with the depressive symptoms. So what is the treatment for a person with vitamin B12 deficiency and depression? So along with the routine antidepressant treatments, augmenting these with vitamin B12 is essential. So either depending on your levels of vitamin B12, you may be given oral vitamin B12 or injectable vitamin B12, which helps in improvement in the depressive symptoms. The levels of vitamin B12 below 200 picograms is considered to be low vitamin B12 levels. So along with the medications, you should also improve your dietary intake of vitamin B12. So if you are a vegetarian, increase the amount of dietary intake, dairy products in the form of milk, yogurt, curd, paneer, cheese, etc. If you are a non-vegetarian, increase the amount of non-vegetarian food. So all of this can help to improve your vitamin B12 levels. Then coming to another more common psychiatric problem, that is schizophrenia. So this is a brain condition where there is dopamine excess. So it affects about 1% of the population. So 1 in every 100 people are affected by schizophrenia. So how do these people present? You find them to be muttering to themselves, smiling to themselves, suspiciousness in the form of somebody is trying to harm them, or somebody is trying to do black magic against them, or somebody is putting some thoughts inside their brain, somebody is plotting against them. These are some of the suspiciousness, and the more common one is suspiciousness on their spouse. So apart from this, their self-care is disturbed, they're not able to focus on their day-to-day activities, sleep is disturbed, the food intake is not good, and the most important thing is they don't have insight into their problem. They don't identify that they are suffering from this condition. So it's the role of the family members who needs to identify there's something wrong with these people and get them treated. Is there a treatment for schizophrenia? Yes, definitely. It can be treated. There are very good medications for schizophrenia, from tablets to injectables to monthly depot injections, which can control the symptoms very well. Most of the people have a doubt if they get addicted to the medications given by a psychiatrist. No. Some conditions need long-term treatment. That's why they are given treatment for a longer term, but it doesn't mean that they are getting addicted to the medications. So for schizophrenia, they are good antipsychotics which are given. Along with that, certain psychotherapies are also available which help in the treatment of schizophrenia. Thank you.